Lung cancer. Lung cancer is cancer that forms in tissues of the lung, usually in the cells that line the air passages. Lung cancer is also known as bronchogenic carcinomas because they arise from the bronchi within the lungs. Cancer is a disease in which cells in the body grow out of control. When cancer starts in the lungs, it's called lung cancer. Lung cancer is the most common cause of death due to cancer in both men and women throughout the world. When we speak of cancer, we are referring to malignant tumors. Tumors can be benign or malignant. Benign tumors do not spread to other parts of the body. Malignant tumors often grow aggressively locally where they start and can enter into the bloodstream or lymphatic system and then spread to other sites in the body. Lung cancer begins in the lungs and tends to spread very early after it forms. It's a very life-threatening cancer and one of the most difficult cancers to treat. Lung cancer can spread to any other organ in the body such as the adrenal glands, liver, brain and bones are the most common sites for lung cancer metastasis. Causes and risk factors. Lung cancer can affect anyone, but there are certain factors that raise your risk of getting it. Common causes include smoking. Cigarette smoking is the principal risk factor for the development of lung cancer. Your risk of lung cancer increases with the number of cigarettes you smoke each day and the number of years you have smoked. Quitting at any age can significantly lower your risk of developing lung cancer. Passive smoking or secondhand smoke also can cause lung cancer in non-smokers. Exposure to asbestos, arsenic, nickel, diesel exhaust or tar in the workplace, personal or family history of lung cancer, exposure to radon gas. Radon is produced by the natural breakdown of uranium in soil, rock and water that eventually becomes part of the air you breathe. Unsafe levels of radon can accumulate in any building, including homes. Other causes like lung diseases, air pollution, and previous radiation therapy. If you have undergone radiation therapy to the chest for another type of cancer, you may have an increased risk of developing lung cancer. Symptoms. Lung cancer typically doesn't cause signs and symptoms in its earliest stages. It may be found during the chest x-ray done for another condition. Signs and symptoms of lung cancer typically occur when the disease is advanced, which may include chest pain that gets worse with cough or laugh, a worsening cough that does not go away, chest infections that return or will not clear, shortness of breath, wheezing, coughing up blood or blood tint or rust colored sputum, hoarseness, loss of appetite, unintentional weight loss, fatigue, or lack of energy. Advanced lung cancer symptoms that might appear include bone pain, invasion of the esophagus may lead to difficulty swallowing. Cancer that has spread to the brain may cause a number of neurogenic symptoms that may include blurred vision, headaches, seizures, or symptoms of stroke such as weakness or loss of sensation in parts of the body. Psychological symptoms such as depression and mood changes also are common. Types of lung cancer. Lung cancers are grouped into two main types based on the appearance of cancer cells under the microscope. They are small cell lung cancer and non-small cell lung cancer. These types of lung cancer grow differently and are treated differently. Small cell lung cancer occurs almost exclusively in heavy smokers. Non-small cell lung cancer is an umbrella term for several types of lung cancers. It includes squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Non-small cell lung cancer is the more common type. Stages of lung cancer. The stage of lung cancer refers to the extent to which cancer has spread in the body. Staging involves the evaluation of cancer size and its penetration into surrounding tissue, as well as the presence or absence of metastasis in the lymph nodes or other organs. Staging of cancer is critical in estimating the prognosis of a patient. The terms used to describe the severity of cancer are localized or stage 1 and 2, the cancer is confined to the lung. Regional or stage 3, the cancer has spread to lymph nodes within the chest. Distant or stage 4, the cancer has spread from the chest to other parts of the body. Diagnosis. Doctors use a wide range of diagnostic procedures and tests to diagnose lung cancer. These include the following: a medical history to learn about the symptoms and possible risk factors, a family history, and a physical exam. If the results of history and physical exam suggest lung cancer, more tests will be done. These could include imaging tests or biopsies of the lung. An X-ray image of lungs may reveal an abnormal mass or nodule. A CT scan can reveal small lesions in the lungs that might not be detected on an X-ray. Magnetic resonance imaging and positron emission tomography scans may be appropriate when precise detail about a tumor's location is required. Lung function test measures how much air the lungs can hold and how quickly the lungs can be filled with air and then emptied. Bone scans. Doctors may order a bone scan to determine whether lung cancer has metastasized to the bones. Lab tests include blood to check the number of red blood cells, white blood cells, and platelets, and sputum tests to see if it has cancer cells. Bronchoscopy. This allows the doctor to look inside the large airways using a bronchoscope, a flexible tube with a light and camera. Patient will have sedation or a general anesthetic, then the doctor will pass the bronchoscope into his mouth down the trachea and into the bronchi. If the tumor is near the bronchi, samples of cells can be collected. Needle biopsy. Fine needle aspiration through the skin, most commonly performed with radiological imaging for guidance, may be useful in retrieving cells for diagnosis from tumor nodules in the lungs. Needle biopsies are particularly useful when the lungs tumor is peripherally located in the lung and not accessible to sampling by bronchoscopy. Thoracosynthesis, aspiration of a sample of pleural fluid with a thin needle. Molecular testing. The biopsy sample may be tested for genetic changes or specific proteins in the cancer cells. The tests are known as molecular tests and help work out which drugs may be most effective in treating the cancer. Careful analysis of cancer cells in a lab will reveal what type of lung cancer the patient has, and knowing the type and stage of lung cancer helps the doctor determine the patient's prognosis and treatment. Thank you.